the problem that we were trying to confront with forming a Tri-County Collaborative, that we consistently saw data that was not consistent on a regular basis from our SNF partners.
And to tag on to that, I think we had recognized that we were all working on SNF collaboratives in our various organizations. We really came together and decided that it was probably best that we do this collectively.
Well, the first thing we did to implement the change was we got together and it really had kind of a round table discussion as to what challenges that we all faced together. And then based on those challenges, we figured out what was the most pressing need.
We also, as we started meeting together as 3 organizations, and then really realized that we needed probably an objective party. And so we had been working with MPRO on various things, and so reached out and asked if they could support the work and help us. And really the development of the portal really kind of, I think, changed what we were able to accomplish by really standardizing those definitions, the metrics, having a central place for those facilities to report to, and then being able to look at that data in aggregate. So really having MPRO as our partner was pretty critical.
I think the most important metrics out of the SNF portal has to do with the transition to care measures. It's a really vital stage in the care continuum of the patient as they travel from the SNF back to their home. And I think it's a metric we really didn't have a good understanding what was happening, not only for Henry Ford Health System, but what was happening in the region. So I think being able to track those metrics and to see those improved transition metrics really are showing relationship and driving the readmission rates down.
So I think some of the challenges we found is really having the right skill set to be able to submit data, understanding the definitions that were consistent for all of us. So we all compromised a little bit to get there. I think the engagement from other people from the nursing homes other than their administrators or marketers is something we still look to improve, so including more physicians or clinical staff in the process would all be incredibly helpful to us to continue to move it forward.
And also I think it is getting the key stakeholders in the room to make these decisions. We talk a lot about the care that's occurring in the patient, in the SNF, and really getting those nursing leaderships and the physician leaders to the table to make those changes that need to happen.
What are 2 major successes that I think I've seen? One is, for all of us, there's been a reduction in the readmission rate, the SNF readmission rate that we've all are very, very pleased about. The major thing that I've noticed now with some of the nursing homes that I've worked with is that the level of education and just knowledge as far as transitional care has been greatly improved.
I think too, aside from the metrics, the partnerships and relationships that we've been able to build have been incredibly helpful. So we really now, when there's something that happens, or there's some kind of challenge, or there's some question that we need to have answered, we all have relationships with these other facilities. But really, I think bridging that gap between the hospital side, the skilled facility side, really building partnerships to improve patient care is, I see as probably our biggest success.
So where I sort of see this big picture going in probably the next 5 to 10 years is we're starting to see these regional collaborators popping out. I know there's one in St. Joe, there's one starting in Lansing, and we have one here in Southeast Michigan. I'd like to see starting to look at things more of a statewide perspective, really looking and trying to tackle these problems. Maybe there's issues that we've addressed in Southeast Michigan that they could learn from in Lansing. So getting more of a statewide and a regional approach to the successes that we're having, and also successes that potentially other collaboratives are having.
I also see that we're going to be needing more information on specific diagnoses. As we move into the days of the bundles and the all-inclusive payments, needing to focus on specific capabilities or categories such as orthopedics or CHF or acute MI, that's really going to shape again our work as we try and reduce length of stay and build different community infrastructure to support patients outside the 4 walls of the hospital.